Welcome to another episode of Clinical Vignettes. Today we have the story of a young woman in her 40s presenting with acute stroke. We are consulted by neurology because they did an extensive thrombophilia panel and found that she had heterozygous factor V Leiden mutation. So she is heterozygous for the factor V Leiden mutation. And the question they have for us is the acute stroke due to factor V Leiden heterozygosity? All right, let's talk a little bit about factor V Leiden. Factor V Leiden is usually overwhelmingly implicated in venous thromboembolism. So when you think about factor V Leiden heterozygosity or even homozygosity, you're really thinking about VTE, that's venous thromboembolism risk. In someone who's heterozygous for factor V Leiden, the risk of VTE is increased 3 to 6-fold above the general population. So in general, that's not super high. When VTE happens with factor V Leiden heterozygosity, it tends to happen in patients who have another risk factor, such as co-inheritance of another thrombophilia, pregnancy, or hormonal therapy, as in patients who are on oral contraceptive pills. Factor V Leiden tends to present with venous thromboembolism where there are other risk factors present. For example, increased age, patients who have co-inherited thrombophilia, or patients who have exposure to hormonal therapy, including oral contraceptives and pregnancy. So factor V Leiden tends to be an increased risk factor for venous thromboembolism, especially when there are other risk factors present. Okay, so now how about factor V Leiden and arterial thrombosis? Does factor V Leiden increase risk of arterial thrombosis? The answer is it's controversial. It's actually not thought to be, but there are some studies that say yes and some studies that say no. The general consensus is that if factor V Leiden plays a role in arterial thrombosis, it's likely to be a minimal role, and that other risk factors are felt to be more important. So for this patient in whom there is acute stroke with factor V Leiden heterozygosity, we feel strongly that factor V Leiden heterozygosity is not likely to be the most important cause of her acute stroke. And we would say, hey, it's great that you found factor V Leiden, but you got to keep looking. And so we would want to make sure that we are not missing a malignancy, for instance. We want to make sure that she is otherwise optimized in terms of her stroke risk factors. So this is a patient who does smoke, and people kind of underestimate the contribution of smoking to increased arterial disease and increased risk for stroke. And then we would think potentially about prothrombotic states as well, but they are less likely to be the most important reason in patients presenting with acute stroke. All right, so that's been the case of a patient who presented with acute stroke in the setting of factor V Leiden heterozygosity, and we don't think that factor V Leiden heterozygosity is the reason for the acute stroke. All right, that ends today's case. I look forward to talking with you again next time.